I think it is genuine of people, senators around this chamber. There is a genuine care and concern for people, older Australians, and ensuring that they get dignity in their later years. And I'm not doubting that in any way. I think that there was bipartisan support for the government's reforms, and we certainly want to continue in that way. Unfortunately, though, at the outset, I do need to make it clear that while the government shares the intent of this private senator's bill, as it's currently drafted, we're not able to support its passage. We're concerned that in practice its provisions will be counterproductive and may not achieve what they set out to do. There is a lot of nuance when we talk about the way that these assessments are happening, and so I am going to put on the record the information that Australians do need to understand and know about how the government is progressing the most historical reforms in the aged care system ever delivered and the most amount of funding ever delivered to the aged care system. The integrated assessment tool that we're talking about today, also known as IAT, and associated classification and prioritisation mechanisms are central parts to fixing a system that was previously slow, inconsistent, and in too many cases, and this is very important to understand, actually unfair to older Australians. Unfair because they weren't getting the right assessment that they needed. It is part of a broader reform agenda that is fixing a system which was failing, not just older people, but their loved ones, aged care workers, and indeed all of those committed to the task of caring for those who have given us so much. President, the Royal Commission into Aged Care Quality and Safety shocked Australians with its damning assessment of a failing aged care system. The final report, tabled in Parliament on the 1st of March 2021, made 148 recommendations, calling for fundamental reform. Since then, since coming to government, we've been getting on with the job of delivering those recommendations, putting in place the once-in-a-generation reforms that are needed to deliver high-quality, world-class aged care services to the older Australians who built this community and to whom we owe compassionate care. But we know that generational reform is not a single moment, it is a long-term project. And with the commencement of the new Aged Care Act on the 1st of November 2025, we've already seen many improvements to the way that care is delivered to older Australians. And this has meant that we are now providing more care to more people more quickly. As of the 31st of March, a record 300,000 older Australians have access to the ongoing support at home place. And with the delivery of an additional 83,000 places last financial year and another 32,000 to come this financial year, by the end of the 2026-27, 420,000 older Australians will have access to support at home. This is almost 3 times as many older Australians compared to the number that had a home care package in 2020. This is the volume that we are talking about. But we also said that we'd watch closely as these reforms roll out and make adjustments to ensure that it is delivering what older Australians need. We've been really clear about that. President, the IAT is about delivering a system that's efficient, accurate and fair. It shouldn't matter where someone lives or who does their assessment. Every older Australian should be treated equitably by our aged care assessment systems. And to deliver on that aspiration, design decisions have specifically been made to ensure that consistency, so that for a given set of clinical characterisations, the assessment system produces the same outcome. This is what it means to bring together clinical expertise, of course, and consistent national rules to deliver more equitable outcomes. The explanatory memorandum to this bill states that the bill clarifies that the IAT functions in a supporting capacity only and that the approved needs assessor retains authority to record an assessment outcome based on their professional judgment. And the bill itself says that an assessor's discretion may not be limited by the assessment tool or any other required prescribed by the rules. And as I said at the beginning, I understand the intent of the senators, the private senators bill, but a broad or unfettered discretion for assessors to override the classification or priority assigned under the rules, as is proposed by this bill, would actually risk undermining fairness and, importantly, slowing access to care for many of those who need it. And this is a matter of debate. We take a different view of those opposite and those at the end of the chamber about the need for fairness in the system. And that is what we will be debating today. But under the former Home Care Packages program, senators will be aware that there was a high degree of assessor discretion in determining funding and priority levels. And what that actually resulted in is that people with very similar needs receiving very different outcomes, depending on where they lived or who conducted the assessment. In 2024-2025, for example, around 20 to 25% of packages were approved nationally at level 4, but in some jurisdictions that figure was as high as 60%. That variation created serious equity issues and had a direct impact on wait times for care. We also saw the consequences of that inconsistency in the accumulation of large volumes of unspent funds across the system, highlighting the limitations of a process-based subjective decision-making with inadequate focus on fairness and consistency. By the time the new Act commenced, $4 billion in unspent care funding was sitting in people's accounts. Money that could have been delivered, could have delivered more care more quickly to more people. Now, I want to be clear about this. The government understands and appreciates the intent of the private senators' bill, and I'm not for 1 minute. It's not that I think that the Senator Ruston or other senators are not genuine in their concern for older people. But we are concerned that the consequences of these provisions would have significant cost implications. An early analysis from the Department of Health, Disability and Ageing is that the cost of these amendments to the Act would be significant. The senators proposing this bill have not explained how these costs would be met within the aged care system. We are also concerned that departmental advice also shows that the provisions could have major implication for wait times, blowing those out by an estimated 5 months. These concerns should not just be brushed away as if they are of little consequence. Wait times and the cost of aged care and where that money is spent is so important to older Australians. There is a reason why the assessment system had to change from what was before. I can't be clear about that. There was an unfair system that was resulting in people not getting the care that they needed. There is a reason why the rules that governed the process were decided, that they went through a robust parliamentary scrutiny process. There is a reason why the Parliament agreed that these rules would be what they are. And a provision, as is included in this bill, to allow assessors to, in any circumstances, set aside what is prescribed by the rules that were decided by Parliament, will not deliver the equity that this system should be maintaining for older Australians who deserve dignity, equity and fairness. President, being a responsible steward of this system upon which so many older people rely means approaching changes like this in a careful and considered way. It means working together, hopefully in the same bipartisan way that we brought the Aged Care Act to this Parliament, to deliver on the needs of those in our community. That's why the government has announced that it will establish a new legislated escalation option so that outcomes of the aged care integrated assessment tool can be changed in extenuating circumstances. This means in the same number of cases where a person's complex circumstances are not fully captured by the integrated assessment tool, under this new pathway, their assessment can be escalated to the system governor and adjusted if necessary so they do get appropriate care. This will provide practical, responsible protection without compromising the care of older people, and will use the parliamentary break to consult on what this will look like so it can be implemented. We are willing to work together with those opposite, as we are with all senators in this chamber, to find a way to achieve the intent of this private senator's bill without the adverse consequences that are currently before us. This is what older Australians expect. When the Royal Commission was delivered, as I said previously, it shocked Australians. It shocked Australians because we expect that older Australians who have lived their lives, paid their taxes, contributed to our communities and our economy are taken care of in the most dignified way. And that was not happening under the previous government. Those recommendations, 143 from the Royal Commission, need to be implemented, and the government has been working to do that. We know that this is a challenge. We know that this is generational reform, but it is this government that has taken it on. It is this government who is delivering. We want to ensure that the expectations of older Australians of their government to meet their needs, to ensure that we deliver on the recommendations, that we make sure that the system is fair and equitable no matter where you live, no matter who does your assessment. That's the expectations that older Australians, and indeed all Australians, have of us. And I understand, as I said at the beginning, just to finish here, I understand that there is a genuineness to the debate that will happen today. That I don't dismiss the care and concern that those opposite anyone in this chamber has for older Australians. The government shares that concern, and that's why we're implementing these reforms. It's why we are making sure that those 143 recommendations are implemented. That is why the government introduced the new Aged Care Act. We brought it to Parliament. Parliament decided on the rules that would be implemented, and the system that we've developed is making sure that the rules are implemented in a fair and equitable way. This bill would result in longer wait times and higher costs to a system that cannot afford either. And so I do want to say that the government will not be able to support this bill, but we are working incredibly hard to review the system, to ensure that there is an escalation system in place. We will consult on what that looks like and bring that back after the break to ensure that it is legislated, hopefully with bipartisan support. Thank you.
Senator Nita Green rises in the Senate and admits there's genuine concern for older Australians across the chamber, but she makes it clear the Labor government won't support Senator Anne Ruston's bill to restore human override to the new aged care assessment tool. She says while they share the intent, the bill would be counterproductive, risk fairness, blow out wait times by months, and cost a fortune. Green talks up the government's record reforms, extra funding, and how the algorithm brings consistency so people get the right care no matter where they live. Yet the complaints keep coming. Review requests exploded after this system started. Families and assessors say the computer is under-assessing real needs, especially for complex cases. The Senate listened. The coalition, Greens and David Pocock, teamed up and passed the bill anyway. That forced Labor to quickly announce an escalation pathway for extenuating circumstances, a classic last-minute move after the numbers turned against them. Look, everyone wants a fair system that doesn't waste taxpayer money, but when trained professionals can't override a flawed algorithm on decisions that affect whether elderly Australians can stay safely at home, something's gone wrong. Older people aren't data points. They deserve care based on real human judgment, not just rigid rules designed in Canberra. This cross-party push shows the pressure is working, but Labour still needs to deliver fixes that actually match the problems on the ground.